Hello, my name is Ethan Liebross. I'll be going over the abdominal and digestive anatomy today. So here we have to label these indicated structures, and these are the salivary glands. So number one over here is the parotid gland. Over here is the submandibular gland, which lies right along the mandible. And over here is the sublingual gland, lingual as in language. It lies right below the oral cavity and the tongue. So here we have to also label these indicated structures. So number one, this big large structure on the right side of the human body is the liver. Right below it, this sac, this green sac is the gallbladder. Number three, this structure here, you may recognize, it's the stomach. Tucked away behind the stomach is this long structure that kind of, you can't really see, but it goes all the way back here. Kind of looks like a fish in shape, and that's the pancreas. Tucked next to the stomach over here, number 5, that's going to be the spleen. 6, over here, it's the first part of the small intestine. It runs, it's right after the stomach, and this is the duodenum. Number 7, this top of the large intestine that runs right over here horizontally, that's called the transverse colon. 8, it's the second part of the small intestine, and that's the jejunum. 9, coming down, is the descending colon, which is also part of the large intestine. The colon is another name for the large intestine. 10, where's 10? 10 is right over here. So it's the third part of the small intestine, and that's the ileum. So 11, going up, is the ascending colon, which makes sense given its name. 12, attached to this right here, this little kind of sac looking thing, the appendix, which is known to rupture. So 12, this is the appendix, 13, and 12 is called the cecum. And 14, over here, makes an S shape, and it's the very end of the large intestine. And this is called the sigmoid colon. So moving on, the next question asks us, what is the landmark at this intersection between these 4 quadrants where the longitudinal and the transverse reference lines intersect? So at the center of these 4 quadrants, what anatomical surface do we find? And that is the belly button. So the belly button is right there. So remember, when we're thinking about quadrants, this is in reference to a patient. So our right side is as if we were the patient. So this question asks, in this right upper quadrant, which is the right, is the patient's right, what is the largest structure that we see? And it would be the liver, which is this large brown structure right up top. So what is the organ in the left upper quadrant? So we're looking right over here. What is the largest organ in this quadrant? What do we see? And that would be, the largest one is the stomach. You could also say spleen, but the largest one we see clearly, most clearly, is the stomach. So here we want to know what are the organs that make contact with the inferior surface of the diaphragm. So we know the diaphragm is right up here if you follow along my arrow. It's right up top here. So the liver is one that outlines the diaphragm, which is a big muscle. The stomach also outlines it, if you can see, as well as the spleen, which is hidden right behind the stomach, right posterior to the stomach. So next, the organs closest to the pubic bone. So here, labeled nicely for us, is the pubic symphysis, which is right down here. So we're looking at what organs are closest to the pubic bone, which is right down here. And we would say the sigmoid colon, which is this S-shaped colon that leads to the rectum, as well as the ileum of the small intestine, which is right over here. Next, we want to know what are the organs that are deep below the belly button. So if we push on our belly button, I know we can't feel it, but what is right behind the belly button? And that would be the small intestine. So again, if we look at those 4 quadrants right in the center, if we go even further beneath the belly button, what would we find? And those would be the small intestines. So this is a little trickier now to identify because this is a real human cross-section. And not pictured here is the head, but the head would be facing us, the anterior view basically of a human. So we're having to label these various structures. So A is probably the easiest. It's this big brown structure on the right side of the body, and that is the liver. And also we can even see it kind of has those 2 lobes that we can see. One right over here, one over here. So B is this large open space on the left side of the body, and that is the stomach. So C, which is a little more inferior to the liver, we find the large intestine. And we can even see a little piece of feces in there. D, right hugging the stomach, right over here, we find the spleen. E, right over here, is the small intestine, and we know it's small because it's smaller in width, a little smaller in diameter as well. It even has those microvilli to increase the surface area. So we can easily identify that those are indeed the small intestine. So moving on, we're now tasked with identifying the structures of this cross-section of this female we see here. So number 1, and we have some hints too that we can refer to. So it's the part of the digestive tract that leads to the anus. So the anus is over here. So leading to that, it's that S shape we see again. So that would be the sigmoid colon of the large intestine. So number 2, over here, it's an open space. It's often filled with liquid. So what could this structure be? So this structure is actually the bladder. Next, over here, is a part of the digestive system that is important for nutrient uptake. So this is the small intestine. So last but not least, we have up top, and that structure is the liver. So moving on, we're asked to compare these 2 structures. So one on the left side of the screen is the female, and on the right side of the screen is the male structure. So it's kind of like playing Finding Waldo, but what structures, what do you notice? What are different between these 2 structures? So number 1, if we look at the sigmoid colon, it's kind of harder to see. And the reason for that is this is just a different slice of the human body. Number 2, what I notice is that the bladder in the male is slightly larger. Over here, the bladder was, this open space was slightly smaller. For 3, if we look at the small intestine, it also looks a bit smaller. And then 4, which is the liver, they look pretty much identical, which is that brown structure superior to all the rest of the abdominal organs. So up top is the liver, and it looks pretty similar. So number 15, excuse me. Let's try to get oriented here. So first we see the 2 kidneys. On the right side of the screen is the left kidney, and on the left side of the screen is the right kidney. Leading to those kidneys, we see the inferior vena cava, and we see the abdominal aorta. So that just helps us position ourselves. We also have the bladder down here. So what's interesting about this image, what's interesting about the kidneys, is that if we have a pencil and we try to rest, imagine if you put a pencil here, would it, between these two kidneys right up top, would it lie flat? And the answer is actually no. The right kidney is a little positioned a little lower than the left kidney. So we might ask, why is this? And the answer is because what organ is on the right side of our body? What is that big organ up top in that right upper quadrant? And the answer to that is the liver. So the liver is taking a lot of room over here, and that's why the right kidney is slightly lowered. So in this image, we see another cross section. This cross section is an inferior transverse cross section. So just to orient ourselves, the body is on the right side. So the left side of the human body is on the right side of this photo. So that's a little tricky. What you can imagine is that we're a doctor at the patient's feet looking down towards their head, and they're facing up with their stomach up. So hopefully that helps you orient yourself. So the first question asked, how do we know what structures are anterior? So remember, anterior is closer to the front of the body. So what I did here was I saw that we have right in the middle, but more posterior, is this spine. So that kind of helps you orient. And then, so the spine is posterior, and there's a number of structures that are anterior. So over here we have the kidneys, we have intestines, and over here we can even see that there are some vessels running more anteriorly. So that kind of helps orient yourself a little bit. So 17, we're actually asked to identify these structures. So as I said, A over here is going to be the large intestine. It's a big open space. Over here, to compare it, for some comparison, compare and contrast, over here is B. These are smaller structures, more surface area, more villi, and those are going to be the small intestines. And C and D, it makes it kind of easy. These are the same anatomical structure, and they are the kidneys. And what's interesting again is that why is on the right side of the screen, why is that kidney so much bigger than the kidney on the left side of the screen? And again, that's because of the height difference. So moving on, as I said, in front, so more anterior to the big spine over here, we see two big vessels. So they're major blood vessels. So we know that they can either be the abdominal aorta or the inferior vena cava. So how do we tell them apart? So A is a lot thicker in structure, and it's a lot more circular. So that's definitely going to be the abdominal aorta. It has a lot more muscle because it has to push all the blood to the rest of our body. Whereas B is the inferior vena cava, and it's not as circular, it's not as muscular. It's actually kind of, definitely not as circular as A. Kind of sad looking actually. So that's inferior vena cava. It's delivering, remember, it's a vein, so it's delivering that blood right back to the heart. It's not at as high of a pressure as the abdominal aorta, which explains its structure. So 19, here we have a transverse cross-section again. And again, we're asked to identify some of these structures. So A, it's a big structure. A is kind of the easiest. It is going to be the liver. So B, So the hint we had is that it's a structure that filters blood, and it's the left pair, which kind of implies that there's two. So it's the kidney. For C, it's also an organ that filters blood. And the big hint that we got is that it touches the inferior face of the diaphragm. And as we saw earlier, that means it's going to be either the liver, the stomach, or the spleen. So this is going to be actually the spleen, number C, or letter C, because it hugs D, and D over here is the stomach, this wide open space. So what we know is that E, it's tucked behind D. So E, tucked behind the stomach, is going to actually be the pancreas. So last but not least, we have F hiding over here. And it's a structure that's tucked up behind A. And as we said, A is the liver. So a structure that's kind of like a sac that's tucked up behind A, which is the liver, is going to be the gallbladder. So F is indeed the gallbladder. So moving on, we have two more questions here. So we're asked to identify the mesenteries. And what are mesenteries? So they're double layers of serous tissue within the peritoneum. And they serve many, many functions. They insulate those abdominal organs. They also help protect them. So we're asked to identify A, B, and C here. So in this second image, it's kind of confusing, but if you can imagine, it's the flap pulled upwards to his chest. So in this rather creative drawing, he's pulling up the insides, the mesenteries, and holding them in his hand. So it's kind of a little confusing how that's seen, how to orient ourselves when we look at this. But A up top, right above, right superior to the stomach structure is, and remember we see the gallbladder and the liver. So right over there, right in between is going to be the lesser omentum, which is a mesentery. Below, so inferior to the stomach is going to be the greater omentum. And C, which we can see in these two images on the right, it's a fan-shaped mesentery, and it's connected to the jejunum and the ileum of the small intestine, as you can see here. And that's called the mesentery proper. Okay, so the final question that we had to answer was, would you expect to find the superior mesenteric artery, the superior mesenteric vein, and the vagus nerve in the mesentery proper? So remember that structure C over here. So would we expect to see these veins and the vagus nerve in this area? So the answer is actually yes. And you may be surprised by this because you might think the vagus nerve is just up top near the head, but actually it's known as the wandering nerve. So I have a picture over here of the vagus nerve, which kind of runs everywhere throughout our body, it seems like, especially in the abdominopelvic region. So yes, the answer is the vagus nerve could be found in this mesentery C. The superior mesenteric artery, remember, it branches off of that abdominal aorta. And the superior mesenteric vein, on the other hand, branches off of the inferior vena cava. So moving on, for a fun little example that relates back to these anatomical structures and kind of gives us a real life example is called Crohn's disease. So it's something that my one cousin actually has. And what's interesting is that he wants to be a gastroenterologist, which I find incredibly admirable because he wants to help patients who suffered from his condition. So what is Crohn's disease? It's an inflammatory bowel disease which causes chronic inflammation of the gastrointestinal tract. So unfortunately, there is no cure. So scientists are working really hard right now trying to find a cure. In some patients, the disease only affects the ileum, which is that third portion of the small intestine. And in other patients, that inflammation is confined to the large intestine. So many of the symptoms associated with Crohn's are due to the increased thickness of the intestinal wall. So some of these symptoms are diarrhea, fever, fatigue, abdominal pain, and weight loss. And when you see an image, it's no surprise why this poses many problems. So on the left, this is from a Harvard magazine article. So on the left is a normal intestine, and on the right is a section of intestine from a patient who has Crohn's disease. So the walls are significantly thickened. And imagine digested food trying to leave the body. That's the whole purpose of the intestines, to absorb nutrients and then to ultimately be excreted through the anus through waste, excuse me. So this thickened wall, as you can imagine, causes many problems and complications, unfortunately. So that was just an interesting little example. And we're all finished for today. So thank you for watching and thank you for your time.